Functions of heart. Structure of the heart. The heart is divided into the left and right side by partitions called septa, that is singular septum. The interatrial septum separates the two upper chambers called atria, and the interventricular septum separates the two lower chambers called ventricles. Here you can see the interatrial septum and interventricular septum. So interatrial septum between the atrium and interventricular septum between the ventricles. The heart consists of 4 cell layers, that is endocardium, inner layer of the heart formed by endothelial cells, and it lines the interior of the heart chambers and walls. The myocardium, that is the muscular middle layer of the heart that consists of heart muscle cells. Then epicardium is formed by epithelial cells and forms the outer cell layer of the heart. The pericardium, that is the membranous sac that surrounds the heart, it consists of 2 layers called visceral pericardium and parietal pericardium. The space between these 2 layers called the pericardial cavity, and it contains pericardial fluid. Heart chambers and walls. The human heart has 4 chambers which are responsible for pumping blood and maintaining blood circulation throughout the body. 4 chambers are named right atrium, left ventricle, left ventricle. Blood is only pumped to one direction. 4 heart valves ensure that blood does not flow backward within the heart. The 4 heart valves are named the tricuspid valve, having 3 points located between right atrium and right ventricle. The pulmonary valve located between right ventricle and pulmonary artery, also called semilunar valve. The mitral valve, also called bicuspid valve, located between left atrium and ventricle. The aortic valve located between left ventricle and aorta. The tricuspid and bicuspid valves are also called atrioventricular valves, meaning located between the atrium and ventricle. Coming to the functions of the heart functions to circulate blood around the body. The right and left side of the heart pump blood into 2 different circulations. The right side pumps deoxygenated blood, that is the blood without oxygen, into the pulmonary circulation, while the left side pumps oxygenated blood into the systemic circulation. The right atrium receives deoxygenated blood from the body tissues via the superior vena cava and inferior vena cava. The blood enters the right atrium, which pumps the blood into the right ventricle. The tricuspid valve prevents blood from flowing backward into the right atrium. The ventricle pumps the blood into the pulmonary artery via the pulmonary valve. The pulmonary artery will deliver the deoxygenated blood to the lungs, where gas exchange occurs. Oxygen is taken from the air into the blood, now called oxygenated blood, while carbon dioxide is expelled from the blood into the air. The oxygenated blood returns to the left side of the heart via pulmonary veins. The oxygenated blood enters the left atrium. The left atrium pumps blood into the left ventricle. The mitral valve prevents blood from flowing backward into the left atrium. The left ventricle pumps the blood into the aorta and systemic circulation. The oxygenated blood is delivered everywhere in the body, that is besides the lungs. Blood circulation. Blood circulates around the body via 2 distinct pathways, the pulmonary circulation and the systemic circulation. Together they create a closed pathways that keep the deoxygenated and oxygenated blood separated. Coming to the pulmonary circulation. Pulmonary circulation begins at the right ventricle, where the deoxygenated blood from the body tissues is pumped into the pulmonary arteries and to the lungs. In the lungs, the blood exchanges carbon dioxide, that is waste products, to cellular respiration, that is to oxygen. The oxygenated blood then travels back to the heart and the left atrium via the pulmonary vein. Systemic circuit. The systemic circulation begins at the left ventricle that pumps oxygenated blood into the aorta. Aorta branches out into small arteries which carry the oxygenated blood to the rest of the body. Oxygen is delivered to the body tissues and exchanged to carbon dioxide. The now deoxygenated blood is carried back to the heart and the right atrium via veins. Arteries versus veins. The blood vessels that carry blood away from heart are called arteries. The blood vessels that carry blood toward the heart are called veins. Only in systemic circulation arteries carry oxygenated blood, while in the pulmonary circulation arteries carry deoxygenated blood. Contraction of the heart. The contraction of the muscular wall of the heart chambers called the myocardium generates the force to pump blood. The heart contraction is divided into two phases, that is systolic meaning contraction and diastolic relaxation. Blood is pumped from the chambers during a contraction phase. The heart chambers are filled with blood during a relaxation phase. One round of heart contractions can be divided into the following phases, that is first relaxation phase. Here the blood flows from atria into the ventricles passively via open atrioventricular valves. Then in atrial systole, contraction of atria will occur and pumps the rest of the blood into ventricles. And in ventricular systole, contraction of ventricle forces blood into pulmonary and systemic circulation. So here during the ventricular systole, the atria will relax and begin to fill with blood arriving from vena cava or the pulmonary veins. And in ventricular diastole, the ventricles and atria are relaxed. Here you can see the cardiac cycle. That is diastolic. In diastolic you can see the ventricular relaxation and it getting filled. And in systolic, the ventricular contraction and they are ejecting the blood. Conduction system of heart. So the conduction system of heart controls the rate and pattern of heartbeat. First diagram you can see SA node of the heart. So SA node of the heart is called the pacemaker of the heart. Then after SA node, it's coming to the atrioventricular node, that is in the right atria at the junction center of the septum. And next you can see the bundle of His, then last Purkinje fibers. So in SA node, electrical impulse travels from the SA node to the walls of the atria, causing them to contract. And in the impulse reaches the atrioventricular node, which delays it by about 0.1 second. And third diagram you can see bundle branches carry signals from the atrioventricular node to the heart apex. And finally the bundle branch, this signal speeds through the ventricle walls, causing them to contract. Coming to the sinoatrial node, myocardium contracts after it receives an electrical impulse generated by a specialized tissue located within the right atrium. This is also called the sinoatrial node, also called the pacemaker of the heart. SA node is bundle of neurons that triggers the concentration of the atria during the cardiac cycle. The electrical currents next reach the ventricles, which contract after the atria. The SA node initiates approximately 75 electrical impulses each minute, with variation between individuals, age and general health. Then coming to the Purkinje fibers. The Purkinje fibers are cells in the inner ventricle walls just beneath the endocardium. These fibers run between the ventricles to the apex to the heart. The Purkinje fibers play a crucial role in cardiac cycle. When an electrical stimulus leaves the AV node, it travels via the bundle of His and branches to Purkinje fibers. These fibers then carry the impulse through the inner wall of each ventricle. This causes the ventricles to contract after the atria contract. The ventricular contraction forces blood from the right ventricle to the lungs, that is pulmonary circulation, and from the left ventricle to the body, that is systemic circulation. These three elements generate a healthy heart rhythm known as sinus rhythm. The rhythm or contraction of the heart pumps blood throughout the body. In roughly a minute's time, blood travels from the heart to the body and back. Coming to the ECG and the P-QRS-T system, an electrocardiogram, also called an EKG or ECG, is a diagnostic test used to record and trace the electrical activity of the heart. The electrical activity of the heart is displayed as a P wave, QRS interval and T wave. The P wave correlates to atrial depolarization, that is systole, and atrial contractions. There is not a wave associated with atrial repolarization as it occurs during ventricular depolarization, that is during the QRS interval. The QRS complex correlates to ventricular depolarization as the ventricle contract. The Q wave is the beginning, the R wave the middle of the contraction, and the S wave is the end of ventricular depolarization and beginning of ventricular repolarization. The T wave correlates to ventricular repolarization. Here you can see the ECG waves and what they mean. P wave, you can see depolarization of atria, we are getting a P wave and is SA node triggering, and PR interval if the delay of AV node to allow filling of ventricles. And QRS complex depolarization of ventricles triggers main pumping contractions. And ST segment beginning of ventricular repolarization, that will be flat, and T wave it caused due to ventricular repolarization, that is relaxation of ventricles. Blood pressure. Blood pressure is the pressure exerted by circulating blood against the walls of the arteries, and blood pressure varies from the maximum systole to the minimum diastole and is normally around 120-80 mm Hg. However, this varies between individuals. Blood pressure greater than 120/80 mm of Hg is considered to be high. The medical term for blood pressure is hypertension. High blood pressure is hypertension, that is meaning above pressure. Blood pressure is less than 120/80 mm of Hg is considered to be low or hypotension. The health condition in hypertension is an abnormal condition that is primarily caused by high blood cholesterol. Excess cholesterol is deposited on the arterial walls as plaques. These plaques make the lumen of the artery narrower, which causes the blood to flow with a higher pressure. If an artery becomes completely blocked, the cells supported by that artery will suffer from lack of oxygen and die. If this happens in the coronary arteries, which provide blood to the heart, the result can be myocardial infarction. That's what we call as heart attack. Stroke. An artery leading to the brain can become blocked. This can cause a cerebrovascular accident, also called a stroke. Two types, that is hemorrhagic stroke and ischemic stroke. Coming to the hypotension is also known as abnormal condition in which the blood flows with a low pressure. Hypotension occurs when a large volume of water or blood is lost from the body. If the patient goes for dehydration or any loss, the patient may develop hypotension. The body's loss of water, that is dehydration, can occur during diarrhea or vomiting. The body's loss of blood, that is hemorrhage, can occur due to blood disorders or injury to the blood vessels or any trauma. Hypotension can result in shock. Thank you.